Welcome to the Parents Against Vaping E-Cigarette PAVE podcast, Big Tobacco Mess with the Wrong Moms. I'm Meredith Berkman.
I'm Dorian Furman, and we're the wrong moms.
But we have the right public health family physician and chief medical officer for prevention at the American Heart Association with us today, Dr. Eduardo Sanchez, who is a father of four, a former health commissioner for the great state of Texas. And we are really honored, Eduardo, to have you here with us today. So thank you so much for joining the PAVE podcast.
Thank you for having me, and thank you for what you do. This is a really important issue that we need to get in front of and protect our kids and protect our people from. So thank you.
We've talked a lot, in our messaging and in educating parents about the dangers that these products, nicotine-flavored vapes, flavored nicotine products, are causing to our kids' brains. And we've talked a lot, certainly, even more so since the pandemic began, about the damage these products are causing to developing lungs. But we'd really like to talk to you about the cardiovascular damage. You know, what are the dangers, both short-term and long-term, to our kids' hearts when they are addicted to nicotine and vaping these flavored products?
We're in early days of kind of knowing exactly what vaping does to the cardiovascular system. But there's growing evidence in animal models and some cell models that vaping and the chemicals in the vaping, yes, they are causing at least some short-term damage. And the worry would be that they can cause sustained damage. And the bigger worry is that being addicted to nicotine can lead to going from vape to tobacco that is smoked. And smoked tobacco is undoubtedly a very, very serious danger to our cardiovascular system. I know we're not talking about that, but I just want to remind folks who are listening that still today, tobacco use is the number one behavioral cause of death in the United States of America, period. And the degree to which vaping can lead to young people who then become adults to smoke cigarettes or other combustible tobacco is very, very worrisome. So not only what vaping does in the moment to the cardiovascular system, but what vaping can lead to, because there's good evidence that that transition does happen.
I'm glad you brought that up, because something that a lot of people say is that vaping is smoking cessation, that it's safer than cigarettes. But for the moment, there's no proof of that. Let's just be clear. It is not safer, and it can often lead to dual use. Is that correct?
That is absolutely correct. Dual use is absolutely a thing. I do think it's also important to say, in this harm reduction conversation, you are correct. There's no good evidence that vaping helps people quit smoking. But the other is that you've replaced one addiction, or at least one form of nicotine addiction, with another one. And as a parent, I'm just not comfortable with the idea that my kid is addicted to nicotine. Like, that just cannot be a good thing. And I'm saying that as a parent, and now as a scientist, I would say not a good thing. And one of the challenges is that that the American Heart Association has worried about, and I'm sure in other podcasts you've had this discussion, is that we still don't have the tools to effectively de-addict children who are addicted to nicotine from the nicotine they're addicted to. That's a huge problem.
So talking to you with your public health warrior hat on, what has to happen for there to be across the board research into the best cessation services or treatment for young people? And what can we do to accelerate that because all the time we hear from parents who are desperate to help their kids get off of this.
The bad news is that we're in the situation that we're in. The good news is that I think there's a concerted effort to find those interventions that are going to make a difference. And so whether it's the American Heart Association, which has put $17 million into the research system to fast track research around the health impacts of e-cigarettes and nicotine on youth. Other organizations, sister organizations like the American Academy of Pediatrics, are also combing and doing and sifting through the science to find, at the very least, promising interventions as we build the evidence base. There is a warp speed effort to figure out and find those interventions that will help young people become unaddicted to nicotine.
This is an entire generation of kids that would otherwise not have been initiated into tobacco use, but for these flavored vape products. We hear from parents all the time who are being forced to send their kids to inpatient rehab, and they are paying for it out of pocket. And when we started this 2 years ago, those stories were coming at us, but they were, people felt those were the quote, most extreme cases. But as this has gone on, we have heard more and more about this. You're going to have the haves and the have-nots. So those who can afford some kind of inpatient or outpatient treatment or some kind of private intervention to help their kids will be able, God willing, to have their nicotine addicted kids become former vapors for life, as you said. But those who do not have those resources, and this is a story as old as time, their kids will be, I hope not, vapors for life or smokers for life. So how do we fight against that? And I know it's early, we're still trying to figure out how to treat these kids, but we're in this for the long haul because we want to be advocating for these young people who, in terms of cost-benefit analysis, they're going to have long-term consequences.
We absolutely have to have a dual approach, one of prevention and treatment simultaneously. We have to do everything we can to keep even one more child from becoming addicted to nicotine. That's critically important. So we've got to do that. And part of that comes from the lessons we've learned from combustible tobacco, right? That you need policy level levers. You need awareness and education level levers, and you actually need some. In addition to the policy, kind of the regulatory piece, which means no vaping in certain places could mean, and taxation is another one that I would add to that list. So that's one thing that has to happen. The other is that we need to have, I believe we need to make sure that we are approaching the development of science in a way that, to your point, Meredith, addresses the issue of equity and assures that there aren't folks left behind because of pocketbook issues that disadvantage those that don't have the resources to pay for the things that in the moment are being done without necessarily the strongest science to support them. Because as I'm listening to you about intensive inpatient, the question I would have is, what's that looking like 6, 9, 12 months down the road? And are there characteristics of who was a success, and what are the factors associated with the success? What are the factors associated with less than success? Relapse, and can you apply what's been learned in the intensive inpatient setting to an outpatient setting? And again, I think to your point, there's a we need to do something now sensibility about this, but there's also the truth is we've got to have a little bit of the science to make it happen. And again, not to go off on COVID, but one of the challenges that we've had in this time of COVID is that every new solution we want to apply immediately. And the scientists and the public health folks say, let's hold back a minute. Let's do this in a systematic way to be sure that what appears to be working is nothing more than what was either going to happen anyway, or is not really the result of the intervention itself. It was going to happen on its own. So really non-specific. And Meredith, I just don't know that there's a good solid answer, except that we've got to continue investing in the regulatory control. We've got to keep the pressure on to have taxes in place that become a disincentive to purchase product for young people. We've got to have the bans in place that will keep at least public vaping from happening, even as we build the evidence base around what will work and what won't work. I will tell you that our experience in Texas around tobacco was that when we invested the dollars to do public awareness of kids and adults, and we invested the dollars to do multi-sector interventions. So in the school systems, helping them figure out what rules they needed to have in place. In the medical care settings, what information could and should be provided based on science. Having quit lines, 1-800-I-WANT-TO-QUIT. I made that one up, but they're quit lines. We could have youth and peer supported I want to quit vaping lines and begin to build the evidence around that. We know that peer-to-peer works in all sorts of substance abuse situations. Couldn't that be a thing that we would explore? But what we learned in Texas was it took all of it together to make a difference around tobacco use. But when we compared counties where we did that level of intense public health intervention, which didn't cost too much, those interventions had fairly dramatic populational effects that we could measure. And when it came to those communities where we did that, not only did we see less kids start smoking, because we're talking about tobacco here, but can we apply what we've learned in smoke tobacco to some of the approaches that we are exploring and evaluating for vaping? We saw less kids starting to smoke, more adults quitting smoking, and we saw a very immediate effect on heart attack admissions in hospitals when we put these programs in place in a handful of counties and compared them to the counties where we didn't do it. So I think the promising thing is that we've learned some things with tobacco that maybe we can apply to vaping. Is it a one-to-one? Absolutely not. But are there elements that need to be a part of it, including raising awareness, finding those behavioral interventions that'll make a difference, equals quit line, even as we build the evidence base for how we get kids unaddicted to nicotine.
You're a public health warrior on so many levels, and we are so impressed by what you're doing, what the Heart Association is doing, and we consider you and the organization partners because we're not going away and the problem's not going away. We got to all fight it together. So thank you so much, Eduardo. I really appreciate it.
Thank you.
Thank you so much for listening to today's podcast, Big Tobacco Messed with the Wrong Moms.
If you're a parent and you want to get involved, please check out our website at parentsagainstVaping.org.
We need passionate parents to join our grassroots movement across the country to protect our kids from the predatory behavior of big tobacco.
To get involved in local advocacy campaigns, please text PAVE, that is PAVE, to 72572. Parents' voices matter, and you can make a difference.
Do you have a teen or young adult at home that vapes? This is Quitting is a free and anonymous text message program designed to help young people quit vaping. Teens and young adults can text DITCH VAPE to 88709 to sign up today. That's provided by Truth, the National Youth Tobacco Prevention Campaign, from our partner and sponsor, the Truth Initiative. It's the first of its kind program that helps young people feel motivated, inspired, and supported while quitting. More than 150,000 young people have enrolled since the program launched in January 2019.
The messages include evidence-based tips and strategies to quit, combined with real feedback from young people. Again, teens and young adults can enroll by texting DITCH VAPE to 88709. Truth Initiative also offers free text messages for parents who are helping their children quit vaping. I myself enrolled in this program as well and would get different ideas and tips to help support my son. You can join the program by texting QUIT to 202-899-7550 or by visiting becomeanx.org to sign up.
To learn more about Truth Initiative and its programs, visit truthinitiative.org.